So, I'm gonna do a couple of phone calls. I know it's really ghetto in the back. I'm trying to get rid of that thing, but not trying to be, whatever. It's a little the bed in the back. It's because I was trying to throw it out, but it's too heavy for me, so that's why. Anyway, so I'm talking about Medicaid and how bad Medicaid is. Okay. First, I would like to address Medicaid formularies. Okay. There's certain medication that Medicaid will not approve because it doesn't fit the formulary for them, which means that they want you to try all these different medications and then they want you to contact your doctor, have your doctor tell them directly that all these medications that you've tried do not work. And they could be like 50, 60 medications. And they want an explanation of why these medications do not work in order to pay out formulary brands which Rameltian, I'm gonna give you an example. Rameltian is a really good sleeping medicine that my daughter wanted. They wouldn't approve it because it was $600. So they wanted an explanation of why all the other medicines didn't work. And sometimes the doctors do it and sometimes they don't. So that's why it's been really difficult for me. The other thing is trying to get into a good rehab. So what I'm gonna do is I'm gonna actually do a phone call. And I'm going to tell you how many people do not accept Medicaid because Medicaid does not pay out. They do not get reimbursed at all. Some of these good facilities do not get reimbursed. These facilities in New Jersey have like 5 stars, and all the ones with 5 stars do not get reimbursed. And that's why they don't accept Medicaid. That is why they have to do out of network or private pay. So this is what I'm struggling with right now. Trying to get a therapist, trying to get a good rehab. They make life very difficult, and this is what the governor is approving. This is what the governor approves. I feel like the governor has no idea what's really going on with mental illness, and he doesn't understand that these facilities, they don't hire the right kind of people. They need to be, inspected by the kind of environment that these patients are in, and that's where your money needs to go. Okay, because you're wasting money on these state hospitals that are not doing a good job. So let's go ahead and let's call, and I will give you an example of what it's like to talk to some of these rehabs. So for example, I'm going to call Endeavor. Let's call Princeton House. And they are a rehab. And then you can understand what I'm kind of talking about. The attitudes of some of these people that they hire is absolutely disgusting, and the way that they pick up the phone is disgusting. So if you do need some kind of help, when they call, they're not very pleasant. So I don't know if this is the outpatient one, the one that's, oh, here it goes. Okay, so let's call them. So again, I'm calling Princeton House, and let's see what happens. This is for admissions intake.
You agree that medicine Princeton House behavioral health. Our phone system has changed recently. If you would like to speak to an inpatient admission clinician about inpatient treatment, please press 1. If you would like to speak to an outpatient admission clinician about intensive outpatient,
let's do inpatient. And let me talk like I'm struggling and see how they act. I'm taking too long to answer the phone. That's number one. For someone who's addicted, they can't be taking this long. They could lose the phone call. This person's
all agents are busy with other customers. Please continue to hold.
See, it's 3:28. I waited for about a minute. I called around 3:26. And I'm going to kind of mimic how it is when my daughter calls when she's not okay. So I'm going to try to mimic what I go through. And again, it's So let's see how long it takes for them to at this point, the person who's trying to get help is probably getting discouraged because nobody's saying, "Hold on, I'll be with you for, I'll be with you, give me a few minutes." They have them on hold. It's not like you're waiting for a JCPenney catalog, trying to see
All
if you
agents
have
are busy with other
the
customers.
right pant
Please
size.
continue to hold.
This is supposed to be a serious um thing that you're dealing with, whatever your addiction is, and not picking up the phone is not a good sign. That already gets like a negative. That's a negative for me. So it's 3:29. So like again, I called around 3:26, so that's already 4 minutes with the introduction and everything. So a total of 4 minutes already on hold. So not good. And I'm also going to look up on ChatGPT other Medicaid facilities. So that way you can kind of get the picture of what I'm talking about.
All agents are busy with other customers. Please continue to hold.
See. So there's Maryville, okay, which is close to Atlantic City, I heard. Which Atlantic City is horrible. There is lots of drugs in Atlantic. There's lots of drugs everywhere. But you want to stay away from anywhere that's like where those really drug infested cities are, like Camden County and all those places. There's New Hope, which does not do New Hope Foundation does not do mental, they just do substance. So you can't really have a mental problem when you go to New Hope. Turning Point is in Paterson. Paterson is, like I said, it's a very bad area in New Jersey. That's also not a very good facility if you're trying to get your loved one away from the street because they can easily just walk out and there they are, right in the middle of
All
Devil's Playground.
with other customers.
Um,
Please continue to hold.
Care Plus New Jersey is okay for mental health, but they have a waiting list if you're on Medicaid, and they only prioritize on Bergen County residents because they're in Bergen County. So they do service Bergen County people first. Um, Carrier Clinic had a really bad experience with Carrier Clinic. I don't want to get into it right now, but it was not a good experience. I could tell you that the psychiatric unit is covered by Medicaid. I don't know um, if the substance part is. I'm pretty sure it's not. I'm pretty sure that it's private paid for the substance part. But I believe psychiatric is covered, just psychiatric. Uh, Here we go. We're going on 3:31. So 6, 7, 8, 9, 30,
All
5 minutes already.
with other customers. Please continue to
Again, somebody could just quickly just pick up the phone and say, "Hey, I'll be right with you. Don't worry, hang in there." Some encouragement, because at this point, the addict is going to hang up the phone, is discouraged, feels that this is not being taken serious enough. There you go. Not good. Absolutely ridiculous. Oh, and by the way, Governor, just to let you know that there's not that many women residential facilities in New Jersey. It's mostly men based. And if we could go ahead and talk about oh gosh, what's his name? From the Jersey Shore. I can't remember his name, but he just opened up a facility. I know his name. The situation. The situation just opened up a recovery unit.
hold.
I don't know. I'm not going to say anything, but I don't know if it's just men only or if it's together, men and women, but I'm not sure. But I could tell you that yes, New Jersey has mostly men, not very much women. Okay, here we go.
Okay, anything for starting to help us?
Hi, I wanted to know if I could get some help for my addiction.
Sure. What is going on?
I'm actually addicted to opioids.
Okay. Is there any mental health concerns going on or no?
Yeah, I do. I have schizoaffective disorder and bipolar disorder.
Okay. What is your name
My name's Jessica.
and your last name?
I don't want to give out my last name right now. Is that okay?
So in order to be able to do anything with you, I would have to do an assessment, which requires me to document so we can see if you need this level of care. If you don't feel comfortable though doing that with me over the phone, you can always go to a local emergency room, and they can do that face to face with you, and then we can kind of get going that way.
Okay, do you know how long the assessment is?
On the phone or in the emergency?
Oh, on the phone.
It really just depends on what's going on and how your response goes.
Oh, okay. All right, I'll call you back then. Thank you.
Okay, no problem.
Thanks. Bye-bye. Well, there you go. That's what you get. You see, no, I didn't hear compassion at all. Okay. I was calling. She didn't say, well, maybe let's work with me here. No, let me work with you. Let's see what we can do. Let's take your last name later. She could have at least taken some information and then at least reassured the addict that, hey, by the way, I'm here for you. I know it's really hard. Maybe you don't want to give me your last name right now. But definitely a negative on that one. So let's go ahead now and let's call a private insurance that does not take Medicaid. So let's go to, let's see, uh, we will go somewhere nice. Let's see, private pay in New Jersey. Let's see how that goes. Because I'm going to say rehab facilities, which by the way, they cost a lot of money. Okay. So this time I'm going to call that it's not for me, it's for a loved one. So let's take an example and let's call, let's see. We're going to do Cherry Hill, New Jersey, something called Harmony Healing. That's number one that came up on ChatGPT. So let's call them and see how they react. See, and by the way, this is a luxury program, 20 to 80,000 monthly. Um, It seems like a really lovely place. I mean, it's expensive. Let's try get the phone number for this one. And let's just compare, okay? And let's see exactly how their attitude is, okay? Because that we just experienced what it's like with Medicaid. Now let's experience with private and let's give them a call. All right. Let's see if they call it, okay?
Please hold while your call is transferred to an admission specialist. Your
Okay.
experience is important to us, so your call may be recorded for quality purposes.
So it's 3:36. Let's see how long we have to wait. It's 3:36.
In recovery group, you will find a helping hand at every turn of your journey to recovery. Thank you for your patience.
Let's see if there's a
We will be with
difference.
you momentarily.
I thought I thought right away they would. Yes, hi. I'm trying to look for help for my daughter who needs help with her opioid abuse. Trying to see if I could get her some help. She's an adult. She's 28. Yes, she has Medicaid. I like to do at least maybe a month. Can you tell me how much a month is? And like, can you tell me a little bit about it? Like what you do? I'm gonna say I'm gonna say heroin about a bag a day. Okay.
Where are you located?
I'm in Wayne, New Jersey.
I feel a place that I could discover through it. I or see which one. Uh, I,
Right. Yeah. So 28 days for 20,000, so that would and that would include what exactly? Like, would that include food? Okay.
Maybe for
Okay.
help it to develop healthy culture.
Okay, wow, that's a lot of information. So I would actually have to talk to your father about it because he would be the one paying for it. So I could definitely get back to you later on if that's okay.
Sure, yeah, no problem. If you like, you can ask for me. My name is Tony, and we're here to help. And if I'm not here, and blah blah blah.
All right. Thank you so much. Thank you for everything. Have a good one. Okay. Bye-bye. Wow. So what a difference. Nicer. Didn't get into her name or anything. Gave me information. A lot of nice benefits. So completely different ball game. And this is why Medicaid does not pay. So that was $20,000 for the month. But even so, the guy was nice, gave very empathetic, very thorough. This is exactly the kind of behavior that would encourage an addict to get help. So there is a big difference. So let's do one more phone call, and I'm going to do a Medicaid one again. And this time I'm going to call, let's see, I am actually going to call, let me see. Let's call Turning Point because I think Turning Point is definitely a very, how do I say it? It is a very unique group of people. That's all I can say right now. Okay, so let's go ahead and let's see. And this time maybe I'm gonna cry a little bit. I'm gonna cry for this one because I feel like let me see. What, Branson? You know I was just pretending, right? I was just pretending. No, I was pretending. Hold on. Hello? Vic, are you outside? Yeah? Do you need me to open the door? Hello? Vic, do you need me to open the door? Okay, hold on. I will need to pause this live stream. It's not gonna save. Vic, are you outside the door? What? Are you outside the door? Are you outside the door? No. Where are you? Outside the door. Oh, it's locked. Okay, I'm coming. Hold on. Let me know. I just want to open the door so I don't get locked out. Okay, hold on. I'm opening it. Here's my shoes now. Okay, I'm opening it. You got it? You got it? Wait. Okay. Okay. Vic, it's open. Vic?
If you want to be routed to an outbreak,
Look,
please press 0. Your call.
I did all of that and they still haven't connected me with someone.
Hello.
Here we go. Hi, I need some help.
Are you trying to put it on the phone?
Yes.
Hey, I'm gonna go to
Okay, thank you.
your recovery is important part.
Let's see what they do. I hate this place. She heard that I was in distress. Did I not sound like I was in?
The person that is
Look at this.
0
Message.
is unavailable.
Bullshit.
The message after the tone.
This is what I'm talking about. She saw that I was in distress and she transferred me, and look, nobody picked up. Negative for Medicaid, okay? Negative. So I gotta end the stream, but I'm telling you, I'm coming back and I'm gonna tell you exactly. I'm gonna call 5, 6, I'm gonna call a lot more numbers, and I'm gonna tell you exactly the pattern here. And this is the kind of people that they hire for Medicaid. Thank you.